Thank you, Plum, for inviting me and making me a part of this informative session because I personally feel we need more of such platforms where we can talk about health and wellness basically. But when it comes to skin, very less platforms have been talking about it. But because of content creation and definitely the Instagram hype, now skin is also being considered as a part of full wellness, right? So skin is definitely our largest organ, and we need to understand how we can keep it healthy, because the time demands us to look good as the generation that we are going into. We need to even build our confidence and self-esteem as well, because somehow when we go to some seminars, webinars, conferences, or probably any interviews, we really need that kind of confidence as well, right? So I would be moving on to the next slide where we can possibly talk about where it starts. So a lot of people have been talking about pimple, rashes, skin issues at some point of our lives. And we have been quietly emphasizing on this one thing, that because of infrequent washing or probably secreting too much of oil, or maybe because of some miracle creams, we are just, creating these kind of skin issues. But somewhere it is an internal issue. It's all coming from inside to outside. So even in my clinics, when people come to me, I usually start talking about their lifestyle, their gut issue problems, what they've been eating, what they've been consuming, and then coming to the topicals. So when I had a word with Sanjeet as well, it was a topic of concern. I think that are topicals really important or a part of our skin, or it's something else as well, right? So most of the teenagers are pretty much understanding nowadays that topically we've got so many things to work upon, our acne scars to oily skin issues. But definitely there is a root from where all the kind of sebum secretion is starting. That is initially our gut system. I have practiced as a functional medicine practitioner as well in my entire journey. So it is more about how internally even the bread that we are consuming and the milk that we are consuming is contributing to a lot of skin issues as well. So when we talk about acne, rosacea, dermatitis, or any kind of skin concern, which most of the teenagers in their 21 and 25 are dealing nowadays, it's causing a cause of concern because nobody is working internally. Everyone is going towards the branding part, or we can say because we see all on Instagram nowadays. So we try to pop up things topically rather than correcting it from the root cause. What exactly is the root cause that we need to understand? And today, if I make this much amount of difference also to you all, and today you guys go and eat something good, I think I'll do one day of good to you. So probably this is something that I'll be talking about. Can you just move to the next slide? So skin is the largest organ in the body, and initially it is directly connected to your whole body health. Your gut regulates your immune system. I think most of us know that. And 70 to 80% of our immune system is initially starting from our gut. So where is the connection? What is the connection of the skin to our gut? I'm talking about it again and again because there is something that we don't really know about. So to the next slide, we would be talking more about the skin gut axis. There is something that is known as skin gut axis. The difference between this is the bacteria that we are creating inside the gut. There are more than 300 to 500 bacteria initially that forms a conversion inside the gut, and this all goes into our bloodstream somewhere, which is being considered as a part of our skin flora as well. So just as we say that the connection between the skin and the gut is so important, because the gut inside is the inner skin and what we see superficially is the outer skin. So we need to first cleanse the inner skin and then we get that glow. We talk about the flawless skin and we talk about the Korean skin nowadays. So most of the people who really want that Korean or glass skin, which is totally a hype nowadays, please look at the lifestyle those people have. They have a pretty clean lifestyle when it comes to their food, their water, the way they exercise, the way they are putting onto their inner work as well. So somewhere even the stress is regulating that kind of acne nowadays. I meet a lot of girls who are going under a lot of stress at 21 and 25 with PCOD issues, with a lot of stress induced thyroid as well. So these two factors are pretty much common when it comes to acne. So two conditions where I'll be definitely talking about later on how you can initially work on that. And moving to the next slide. Um, some of the underlying skin concerns I witness on my daily basis in my clinic with poor gut health. Why I'm talking about it? Because this is what I notice in my clinic as well. It's not just something that is being only written in the books. So acne is very common. 90% of the girls and boys go through mild to moderate and severe acne as well. So when we talk about acne, I would like people to understand when we have oily food, when we try to have something as junk food, when we try to have something that is creating a lot of cholesterol inside the body, even you can make it out through your blood profiles as well. Today, if you possibly go and check your cholesterol levels, your CBC, your LFT count, your KFT count, you might find a little derangement of certain levels of your blood work. There you can initially make out how much amount of oil secretion is initially happening. One is um, one is the natural process of how much our body initially makes the oil, and the second is what we are contributing to, that is through our food or probably through stress. So a lot of factors initially accumulate and sort of cause sebum production, so which is initially leading to a lot of acne as well. And acne usually are a cause of concern nowadays, because a lot of people think it's just because we have dirt on our face and we have got different products to apply on, or maybe cosmetic application. Trust me, it's all coming from your pores. The pores that you have in your skin, they are initially regulated by the sebum secretion that happens from the cells, and the cells are initially taking all the kind of blood work from the food that you are eating. So it's an entire chain and cycle that you don't see, but possibly every day your skin is doing that work for you, right? So people who talk about 2% of salicylic acid, 2% of niacinamide applying topically, it doesn't work that way. It works internally as well, right? So first is acne. Second is, I want to move on the next slide, dermatitis, which is followed by alopecia. Now, this is something, dermatitis usually is seen in even housewives as well, who frequently wash or maybe, come in touch with something that is usually fungal or even viral as well. So itchy bumps, blisters that appear most frequently along the hairlines, on the forearms, or probably on the elbows as well. So root cause could be again gluten sensitivity. A lot of people don't eventually realize they are lactose intolerant, or probably they are gluten tolerant as well. So what happens is, when you are on high consumption of dairy, that is 2 to 3 milks a day, probably because see, we've been hearing this from a very long period of time, that having milk creates a good amount of bones, right? But there is a point at our age where the milk consumptions or the absorption of the milk reduces down in the body, and that somewhere starts creating inflammation in the body. So that is one of the triggering points why girls even go through PCOD as well. And PCOD causes a lot of acne, a lot of hirsutism, and insulin resistance as well, right? So that is one of the concern. It's all starting from your food, whatever you are consuming today. Third is again rosacea. So this is again what I witness on daily basis. Facial redness, which usually you will see all the areas of your face becoming red. A lot of people have an enlarged nose and the pores are pretty much visible, with a lot of acne, red bumps, and these acne don't settle the entire year. So rosacea again is a triggering factor of how much spicy food, hot food, exposure to the sunlight, and definitely it's somewhere genetical as well. Also with environmental factors are also considered in terms of rosacea. So talking about these three things, I just wanted to focus on that somewhere the cause of concern is your food. The root cause is initially your food. So adjusting your diet may also be very necessary, and taking the steps like adopting a nutrient dense and probably an anti-acne or an anti-inflammatory diet. Um, why I am considering anti-inflammatory diet here, because a lot of people they think having less food can curb this, but it is initially anti-inflammatory because somewhere we are not including the carbs, we are not including high sugar, we are not including the high fat diet. We are just consuming something that is rich in protein, right? So protein somewhere helps you develop a lot of collagen. When you develop collagen, initially your aging process, your skin renewal time, a lot of things starts happening. So maybe you can have a protein rich diet. Like I include a lot of sprouts, lot of dal, lot of chia seed water or lemon seed water, or probably you can have coconut water as well. So keep more of hydration, more of protein into your diet, and definitely fruits are a very good source. Make sure it's a colored plate that you're having, right? Second, coming up to your sleep pattern, it's very important because I talk a lot about this on my reels as well. That your skin pH initially is being regulated by your circadian rhythm. That is the way you sleep. Every time in every hour, your skin pH changes. So, what happens is whenever you touch the mid noon, that is 12, your skin will start becoming too much oily. That is one of the reasons your skin pH alters also. So, managing your stress, managing your hydration levels, probably your sleep cycle, and a good diet could really help you in, probably working out your skin well. Yes. The next slide. So this is how the plate should look like. It shouldn't look like very dull. Purple, yellow, green, red. This is all we need to have. Sometimes it's the colors that add on, but definitely your entire body needs different type of vitamins and nutrients. A lot of people, they're deficient in vitamin B12, vitamin D, probably vitamin E as well. So what happens is when we are deficient into a certain amount of protein, or probably any vitamin and mineral, what happens is our skin starts degrading. It starts stopping, like it initially stops the process of building collagen as well, right? So a lot of people talk about nowadays collagen powder. A lot of people are initially consuming as well the supplements, but somewhere the rate of which our body secretes or probably makes collagen is much faster than what you're consuming, right? So you're just supplementing yourself and it's all excreting out through your urine or maybe through your sweat as well, right? But at the same time, if you include it into your daily routine, right? Like protein is somewhere, we say the amount of weight you have, it's equivalent to your protein. Like if you are today you are 80 kgs, you should have 80 grams of protein, right? So somewhere it's similar to the collagen as well. Today, if you're consuming something rich in protein every day, like dal, right? Like our dadi and our nanis used to say this one thing, right? Like have a proper plate which has curd, which has like everything into it, right? So there was a reason to it, and definitely less sugar intake was one of the reasons, because earlier people used to have good dahi, lassi, charge, and all those things, which really adds on to good amount of like calcium as well. So I'm not specifically talking about the milk that we are consuming today, because it's all somewhere become synthetic. It's not that natural now. So it's becoming a cause of concern for PCOD people as well. So eat the rainbow. That's one of my message to all of you. Next slide. So understanding your skin type, this is one of the very major factors which a lot of people forget to work upon, because when we start applying any certain products, what usually happens is we are not sure of what kind of skin type we have, right? So when you know what is your skin type, you know what kind of active ingredients you can make. But let this work be done by a doctor or probably a dermat or aesthetic physician, because they completely understand what kind of actives you would be requiring on your skin. Sometimes we assess our skin according to what we are watching, right? So what usually happens is 30 minutes of patch test we usually go for. Like you can take a tissue paper and you can just, when you wash your face, initially you can just keep a tissue paper and just dab it on your face. If you feel you have got your T-zone as oily, it has dabbed that amount of oil, keep it for a little while. You will see oil secretion happening. That really means that you have a combination sort of skin, right? If your skin feels very tight, flaky, scaly, even after washing your face, you need to just leave it for a little while just to check how your skin is secreting any amount of oil. So that then definitely it's a dry skin. If it's shiny, then you have a combination skin. And if your skin feels hydrated and comfortable, it's a normal skin. Don't get scared by people, telling you that you have a combination or oily skin or acne prone skin, because we can totally work out any kind of skin type just by balancing the amount of products we need to have. Always remember this one thing: how many we can include thousands of ingredients in our entire skincare regimen, but I have kept it very simple for people. Just a moisturizer, just a face wash, and a sunscreen. These three things are minimal, and you require only three things to work on a balanced scale if you have a normal skin. If you have a acne prone skin, then definitely you need one or two active ingredients to work upon. Other skincare concerns like acne scars or probably any kind of pigmentation, that totally depends on your doctor how the entire course of 3 months or 4 months have to be done, right? Yeah, please move on to the next slide. So these are my favorite skincare acids, which I usually include, whether it's a face wash, whether it's a serum, whether it's a peel, or probably it's a combination sort of, entire skincare regimen I have to make. That is why I've just summed it up in one thing, because I don't want to confuse people with so many things like serum, and there are so many things that we do usually. Excuse me. So glycolic acid, that is the first one. Second is the salicylic acid, retinoic acid, and hyaluronic acid. Now someone like glycolic acid usually works on dull skin, someone who has got pigmentation, lines and wrinkles, or probably mild to moderate acne. Now this initially works on exfoliation. In my personal regimen also, I have taken glycolic acid a lot, because we usually get exposed to a lot of UV rays. So every time we are secreting that kind of melanin, and Indian skins are prone to secrete a lot of melanin. So we can go for glycolic acid in a daily regimen if you have a normal skin, or probably if you have a combination skin as well. Second is salicylic acid. Salicylic acid is just to work on your pores. If you have open pore issues, if you have got acne prone skin, you have got a lot of whiteheads and blackheads, then definitely you can include 2% of salicylic acid into it. Third is a little tougher part, that is retinoic. A lot of people are scared of retinols. So retinols are basically, yes, definitely they need a lot of supervision. They need to be started at a very minimal concentration. Don't ever use it at home just by self-prescribing, because it needs a proper vigilance as well to your doctor as well, right? So any kind of grading of acne, pigmentation, retinols are to be included, but they are worked as a last line of treatment. Fourth is your hyaluronic acid. Hyaluronic acid works on hydration. Someone who has a dry skin, has got a lot of redness or dermatitis, probably can just put hyaluronic acid into their skincare regimen. It was all sum up. I am missing out a few slides here. So topical oxidants, which I wanted to talk about. When we talk about topical oxidants, this is what you all have been hearing, like vitamin C, hyaluronic acid, your salicylic acid, your retinols, your benzoyl peroxide. So these are few topical antioxidants that you need to include. But definitely, as I said, a colored plate is the best antioxidant you can include. So I think that sums up the entire session, because I personally feel there's a time limit to the entire webinar. And I would like to end up the entire session here.